Hey Delaware, I'm Eric with Brandywine Women's Health Associates, a local healthcare advocate in Delaware. Welcome to Brandywine Prevention Network, your healthcare talk in Delaware. This network is here to bring you everything and anything on the Affordable Care Act throughout Delaware. And we have a very special guest in the BWHA studio to discuss an intriguing topic that matters to all of us Delawareans. But before we get into all that complex healthcare business, let's see what's going on in the Delaware community and the Affordable Care Act today.
Terms2Know. The health insurance marketplace is a government website where individuals, families, and small businesses can learn about their healthcare options, compare health insurance plans based on price, benefits, and other important features, choose a health plan, and enroll in health coverage.
A policy year is a 12-month period of health benefits coverage under an individual insurance plan. You can only change or edit your plan during a certain time period within this year, called your open enrollment period. To find out when your policy year begins, you should check out your policy documents or contact your insurer.
Out-of-pocket costs are your expenses for medical care that are not reimbursed by insurance. Out-of-pocket costs include co-payments, co-insurance, and deductibles for covered services. This term includes all costs for services that are not covered.
A premium is the cost of a health insurance plan for 1 year. This amount is usually divided by monthly payments or made in one lump sum.
A co-payment is a set amount that must be paid out of pocket for medical services and prescriptions to the hospital or practice. The health insurance company will pay the rest of the amount. Each medical service or prescription will have a set co-payment that is the responsibility of the insured.
Finally, a deductible is the one-time amount you owe out of pocket for covered health care services before your health insurance begins to pay for your services. Terms2Know. So far, we've covered some basic healthcare terms you should be familiar with. Now let's see what's going on with our community and the Affordable Care Act today.
Every day in Delaware, there are many enrollment events to help you get covered.
At these events, you can meet with an on-site navigator and learn about your healthcare options. Here are a few special events coming to you this August. First off, know someone looking for work? Marketplace guides will be at the Wilmington Job Placement Center from 9 a.m. to 4 p.m. Come and learn about your healthcare options.
Next is for our volunteers. We will be at the Sunday Breakfast Mission on Thursdays. Come serve your community. We'll see you there.
Looking for a weekend event? Navigators will be at the Newcastle Farmers Market from open until close. Come shop and get covered at the same time.
Finally, we're helping parents get covered and geared up for back to school. There's a back to school rally on August 16th at the Sunday Breakfast Mission. Give back to your community and we can give you some peace of mind. Come renew or enroll with our Marketplace guides.
Looking for more events? Please visit our Brandywine Women's Health Associates website to see where else our Marketplace guides will be throughout the week.
We will be at libraries, community centers, and service centers near you. So check us out. We may be right around your block.
It was important that I have health insurance, and I did not have health insurance because I was self-employed and really just could not afford what it took for me to have health insurance at that time. There was a lot of misinformation out there, and Brandywine Women's Health Associates was able to kind of dispel some of those myths and get to the community the information necessary for them to make intelligent choices. So they came on a Bible study night and shared with everyone, and out of that, even I was helped because I didn't really know a lot. I knew enough to be ignorant, so I didn't really know a lot, but they were able to dispel a lot of the myths even for me. And out of that, on day one, when enrollment came around, I was first in line making sure that I began to start signing up for health. There's nothing like the assurance of being insured. And so I get a chance to go to the doctor, make sure everything is well, and found out that everything wasn't well. he came back with the news that nobody wants to hear. And he said, you know, we caught it early. And I'm like, it what? He said, you have cancer. So it's a very sobering, tense kind of time because, you know, you don't really know what's going to happen as a result of that. You don't know the prognosis. All you have at that point is a diagnosis. And he said to me, your prognosis is good because we caught it early. If we were to have had this conversation a year from now, we would be having an entirely different conversation. And so I'm grateful for the Affordable Care Act because it literally, in my case, saved my life.
Well, that wraps up this installment of the Brandywine Prevention Network. It's been an informative one. I'm Eric with the Brandywine Women's Health Associates. Stay healthy, Delaware.